Hey, thanks so much for joining. In this video, what we're going to cover is everything you really need to know about shockwave. This seems to be one of those topics that has been covered over and over and over again, but yet still nobody understands exactly how it works. So by the end of today's presentation, you'll have a clear understanding on the mechanism of action that happens within shockwave and the effect that it has on the body. So I've prepared a little presentation, so let me just jump over and show you exactly how it works. So here we go. Let's jump into it. Let's talk about how StemWave non-invasively initiates and actually promotes long-term cellular healing. All right. So, like I said, what we'll get into today is really the physics of shockwave, the mechanism of action, the biological effects that actually take place at a cellular level. You'll also understand exactly how to integrate it into your clinic. You'll understand exactly why shockwave right now in the world is really the thing that if you own a private practice, you need to be talking about, you need to be learning about, okay? And you'll also understand, if you stick around, how you can actually get started with this and how you can try this in your office at no risk, at no cost to you, and how you can actually get started with it pretty easily and get good results for your patients pretty quickly. So to understand what shockwave is, you really have to understand what shockwave is not, okay? So what is shockwave not? Shockwave is not laser therapy, okay? This is, a common misconception is that like laser, no, it's not like laser, okay? It's also not radial pressure wave, okay? Radial pressure wave is totally different, and it's not therapeutic ultrasound. This doesn't use ultrasonic waves, okay? So let's break down why it's not these three things. Number one, what is a laser? A laser uses photonic energy, right? This is light energy. Shockwave uses mechanical energy, very, very different. Also, much lower level of penetration depth, okay? And lesser energy to the actual area, okay? If you can think about it, the body's what, 60% water, 65, 70% water? Light doesn't travel nearly as easy through water as, say, mechanical energy, especially a shockwave, right? In fact, a shockwave actually travels faster through water than it would through air, about 4.3 times faster, okay? And so it's completely different. It also has a completely different response at a cellular level, okay? Now, radial pressure waves, these are commonly referred to as shockwave. In fact, you might be showing up to this presentation with a device like this, or you've tried a device like this, where you learned about it in medical school, some sort of school that you went to, and you were told that it's shockwave. This technology was actually declassified as a shockwave technology. It's no longer considered shockwave. And the truth is, it's because it doesn't actually create a shockwave. The way you should think about this is like an extremely powerful Theragun. Now, listen, it does have good benefits, especially if you're using it for, say, maybe plantar fasciitis, some super level tissue or superficial level tissue. It just has a much lesser penetration depth. And it doesn't actually create a true shockwave, a powerful shockwave. And we'll get into what that is later, but that's where all the positive biological effects take place. And then third, ultrasound, or more specifically, therapeutic ultrasound. Therapeutic ultrasound uses high frequency. It uses high frequency energy that is very consistent. If you look at it on a graph, it looks as consistent as possible, not like a shockwave. Shockwaves are categorized by an extreme high rise time. We'll get into that later and why that matters. But what ultrasound does is it actually generates heat to increase blood flow into the area, okay? And it's been consistently shown to have a lesser therapeutic effectiveness for chronic and acute musculoskeletal disorders, okay? There's many studies showing this, so we can get into that a little bit later. But to understand, now that you understand what a shockwave is not, what is a shockwave? Well, a shockwave in physics is just a propagation moving faster than the local speed of sound. Now, something funny happens when that actually takes place. A dramatic change in pressure happens, okay? Now, the easiest way you can imagine this, if you think about an aircraft going supersonic, or you think about a lightning strike. What do you hear? A lightning strike is the easiest way to think about it, right? When you hear a lightning strike, think of the most memorable lightning strike you've ever heard of, right? When you heard of this lightning strike and you heard thunder after, right? That thunder, sometimes it shakes the house, it'll shake the picture in the house, it'll shake something over, you can feel it. That's what sound energy is, right? Now, obviously that's more dramatic, but that's what we're actually recreating with shockwave. We're essentially recreating that sound energy, that shockwave, but instead of it shaking through your whole house, we're focusing it all into one area that travels deep inside of the tissue, okay? And it's much more consistent and much more predictable than a strike of lightning or an explosion. Okay, so these shock waves are mechanical energy. When it goes into the tissue, it's traveling at over 3,300 miles per hour, okay? Faster than the local speed of sound. Okay, and when it travels into the tissue, let's talk about the effect it has on the cell. How does the cell react to this? Well, the easiest way to think about it is you can think about these cells as, think about it as balloons underwater. Look at this over here, these balloons underwater. And there's an explosion taking place next to them. What happens when the explosion takes place? Well, these balloons, they compress and then they expand. They react to it dramatically. They morph, but they're still balloons, right? Now, obviously, this is much more dramatic than what's actually happening within the body and within the cells, but the cells are compressing and expanding. And when they compress and expand, it initiates a cascade of biological responses that are best broken into three phases. So we'll get into what these three phases are. That way you understand the exact response that's actually happening at a cellular level. So the first phase is the angiogenic phase. Okay, what do we know about angiogenesis? This is really what is about improving blood flow to the area. Because what do we know about improved blood flow to the area? Well, we know that lack of blood flow isn't a good thing. When we think about lack of blood flow to the heart, or we think about lack of blood flow to the brain, or we think about lack of blood flow to the feet, right? These are not good things. This is not an environment for healing. But on the flip side of that, blood flow to an area creates an environment for healing. Okay, so let's talk about how we improve blood flow with this type of technology. It does it in three ways: neovascularization through angiogenesis, as well as vasculogenesis. Okay, so the formation of new blood vessels, as well as the formation of new blood vessels from existing blood vessels to create new capillaries. Okay, the second is endothelial cell migration. We'll get into that later. And vasodilation, which just makes it easy for blood flow to actually come. So we're really just sending a lot of blood flow to this area, both short-term and long-term, which is critical that we're not just doing it short-term. So short-term, the migration of endothelial cells as well as cell proliferation, which we'll get into later, really creates a strong short-term effect. But long-term, what's happening is this is through neovascularization, right? The formation of these new blood vessels. And two studies really wanted to exemplify the short-term and long-term effects of this because it's so impactful to have that blood flow in the area. So the two studies, one of them measured over 5 minutes. They wanted to understand what the increase in blood flow to the area could be just by using focused shock waves to the area. So they measured through 5 minutes. They actually sent a measuring tool into a capillary in the hand. They sent shock waves through it. They measured after 1 minute, 2 minutes, 3 minute, 4 minute, 5 minute. And within 5 minutes, there was a 39% increase in the blood flow within that capillary from baseline, 39% above baseline. And then it took 30 minutes after to actually return back down to baseline. Okay, so pretty incredible the amount of improvement of blood flow we can have to that area in 30 minutes. But long-term is actually, much, much more important. Okay, and so this technology, in a different category with different products is often used in veterinarian health. And there was a study done specifically with dogs. They wanted to understand at 4 weeks and at 8 weeks out, would there be new capillaries in the samples that we did? So they tested every sample at 4 weeks and every sample at 8 weeks. And what they found is in every sample, the sample being the dog in this case, every single one had new capillaries, right? So this is really the environment that we want to create short-term and long-term for healing. But this is really just phase one. Phase two is the proliferation and cytokine phase. Okay, what do we know about proliferation? What is proliferation? Cell proliferation and cell regeneration. But cell regeneration is so necessary in the healing process. Cell proliferation is critical to actually tissue repair and tissue regeneration, which is actually happening. So this is why you see the tissue regeneration. This is often used in other categories like wound healing, or some companies with particular products that focus on like sexual health. This is not our market. It's not what StemWave is focused on, but you can see why it would be used in those areas. But on top of the cell proliferation that's necessary, two other things are taking place. One is an upregulation in growth factors, right? An upregulation in certain growth factors that let the body know there needs to be a response here that goes into the third phase, which we'll get into in a second. Some of these growth factors you might have heard of, insulin-like growth factor, right? There's actually an upregulation in insulin-like growth factor, okay? And then the third piece is the biochemical signaling that's happening, okay? So we're actually able to signal and communicate through the cells to the body that a response needs to take place here, which leads me to the third phase, okay? This is the inflammatory phase, perhaps the most important phase. Because what do we know about inflammation? Okay, we know there's good inflammation and we know there's bad inflammation. Okay, the inflammation can really be the cause of most all disease. Some people would argue that inflammation is the cause of almost all disease, right? But with this type of technology, with Shockwave, we're not just decreasing inflammation. Okay, we're modulating inflammation because there's good inflammation and there's bad inflammation. When we think about good inflammation, what do we think about? With good inflammation, we think about the acute inflammatory response, right? That's what good inflammation is known as, right? Acute inflammation, okay? Because acute inflammation is used in the response to a disease, it's used in response to an infection. It's the immune system reacting to something, okay? And this has actually been shown to have an immediate acute inflammatory response, which is great. But long-term chronic inflammation, this is what we want to be able to decrease, okay? And so this is the long-term, we're having a short-term good inflammation effect. Long-term, we're having a great effect, okay, with chronic inflammation. And we do this through biosignaling. And while not everything is perfectly understood, the inflammatory phase can be best broken down into 4 categories, of which I'll briefly cover right here. The first is neuropeptides. When we think of neuropeptides, we generally don't think of Shockwave or this type of technology, but it can actually inhibit inflammation by reducing SP or substance P and CGRP. Okay, so by reducing those, we actually can inhibit inflammation. The second way is through TLR3, known as toll-like receptor 3, the regulation of inflammation, right? So we can regulate inflammation by stimulating TLR3 through, and this is kind of the more complex thing. If you know anything about IL-6 and IL-10, that the complex relationship between interleukin-6 and interleukin-10, you'll know that this is necessary in the healing process. And so by stimulating toll-like receptor 3, we can actually communicate to interleukin-6 and interleukin-10 that healing needs to take place here. And the third, this is part of the positive acute inflammatory response, is the production and release of nitric oxide, which is great. And then the fourth is macrophages. So by modulating the macrophage activity, which is what we're doing here, this is part of the positive anti-inflammatory response. So we're modulating inflammation. There's a positive acute inflammatory response, but long-term, we're actually decreasing and creating an environment for chronic inflammation to go away and really creating an environment for us to heal, okay? Now, those are the 3 phases of healing, but there's one more phase. It's a bit of a hidden phase, okay? And it's not part of the healing process, but it is a pretty profound and interesting effect that this technology has. It's the analgesic phase, right? What do we know? What do we think about when we think about analgesics? We think about pain medication. We think about, a reduction in pain. This has actually been shown consistently to have an analgesic effect on patients. And if you've seen any of our testimonials, if you've seen, any of the ways that patients generally react to this, it's pretty profound. And the reason for that is the analgesic effect, right? They hop off the table, they go, "What? Why can't I feel it?" That's part of what this is. Now, there's a lot of reasons why that happens, but one of the main reasons that happens is really the loss of substance P and the loss of CGRP. Okay, there's also this sounds a little bit more negative, but it's a degeneration in certain nerve fibers that actually make that take place. Okay, but this analgesic effect is both immediate and it's also sustained, especially when you're following protocols of a treatment a couple times a week or a treatment, once a week for multiple weeks. This is an amazing effect on the patients. And in fact, there was this is commonly used in veterinarian health, as I mentioned earlier, with other companies and other technologies. It was actually used with horses before races so they wouldn't feel as much pain. And they actually had to put a regulation around that. So the horses can't use it before the race because of the effect that it has on the horses. Otherwise, they'll run so hard that they hurt themselves. And so I use that to say the analgesic effect is extreme and it is very serious. Okay. Now, that's really the 4-step process. It's really a 3-step process, but it's the 4-step process of what we call our cellular response technology. This is focused shockwave, and essentially it's the gold standard of shockwave. But the 4-step process, to recap here, we're improving blood flow to the area, both short-term and long-term. Cell proliferation and cytokine release for cellular signaling is taking place. Okay, we're upregulating certain growth factors. The modulation of inflammation, both reducing chronic inflammation long-term and short-term having a positive acute inflammatory response. And then 4, the analgesic effect that's actually taking place here, so the reduction in pain, which is great for the patient, especially if they're suffering tremendously. So what is this actually used for? Okay, if you've done any research on this, you'll see that this technology is incredibly versatile. But it's most commonly used with chronic and acute musculoskeletal disorders in areas like the knees, shoulders, hands, feet, soft tissue. These are arthritic conditions, degenerative conditions. It pairs well with a lot of what private practices generally focus on, whether you're a physical therapy clinic, a chiropractic clinic, a pain management clinic, whatever it might be. It normally pairs very, very well. And the way that it was designed is pretty easy to actually do. The treatments actually only take 3 to 8 minutes. Most protocols follow an 8 to 10 sessions. Sometimes it's a little bit less, sometimes it's a little bit more, sometimes there's maintenance, sometimes there's not. It all depends. We have internationally accepted protocols that we train on with this. But the technology is pretty incredible. Most clinics are charging, across the country anywhere from $120 to $200 per session. Okay, like I said, 8 to 10 sessions. The primary reason they're able to charge such as, this is oftentimes higher than what most people are charging for, a less than 10-minute treatment. But the only reason for that is really just because how profound the effect that this has on the patient and the amount of healing that's actually taking place. And in most cases, what our providers report is anywhere from 80 to 95% improvement for patients who qualify. That is dramatic, right? An 80 to 95% improvement for patients who qualify, okay? So if you were excited by this and you want to learn more about how Shockwave actually works, you want to learn more about how this could actually work in your clinic, how you could get started with this. The good news is we actually allow providers to try our technology, StemWave, which is really the gold standard of focused shockwave, what we talked about here. We actually allow them to try it at 60 days at absolutely no cost. There's absolutely no risk. If after 60 days you don't love it, your patients don't love it, you're not getting good results, you don't feel like it's profitable, whatever it is, you can return it at literally no cost. We'll provide the training, we provide the technology, we get you, clinically sound where you need to be. We train your whole staff. We set up marketing solutions and a marketing system for you. And we even coach you on how to present it to your patients, really everything you need to know for the entire process to work. So if that sounds exciting for you and, you want to explore more about how this could help you in your business, we'd love to get into that and talk to you about how it could work and really how we've helped hundreds of clinics throughout the country do this and why we believe it's such a profound technology and why it's really transforming the industry. So if you want to learn more about that, go ahead, click below. You can schedule a call directly with our team. They'll go over exactly how this offer works, how it might work in your market, and we'll see if you have patients that would qualify from this, as well as if your market would do really well with the marketing system. So go ahead, click below, schedule a call. We look forward to speaking with you. We'll talk soon.